Hi everyone, I'm Wei Hsum from the School of Biosciences, Taylor's University. My topic of presentation today will be focusing on foam cells formation, where I'll be talking about targeting macrophage lipids homeostasis and inflammation in atherosclerosis. Atherosclerosis, it is a major contributor to a global epidemic of cardiovascular disease, where it is the leading cause of death and disability worldwide. So it is characterized by accumulation of low-density lipoproteins and remnant lipoprotein particles in focal areas of medium and large arteries, which results in the formation of plaques. So the deregulated lipid homeostasis and inflammatory responses will actually orchestrate the progression of this disease. So the diagram here actually shows the process from the initiation with the formation of foam cells up to the development of the plaques. And they are accompanied with various inflammatory processes with the mediators and markers. Traditionally, atherosclerosis was regarded as a cholesterol storage disease where it is involved in the retention of lipoproteins, including LDL, in the intimal space of arteries. More and more studies have shown that it is accompanied by a chronic low-grade inflammatory response that attracts cells of the innate and adaptive immune systems into the atherosclerotic plaque. So the LDL accumulation will actually initiate and drive vascular inflammation. So as what you can see from the diagram here, it all associates with the initiation from endothelial cell activation, which results in monocyte recruitment and neutrophil recruitments. And from here, they would be able to take up modified lipids and results in the formation of foam cells. It also the migration and clonal expansion of smooth muscle cells, which results in the formation of the necrotic core, where it will also have the occurrence of apoptosis and necrosis within the core and results in the disturbed flow. So macrophages, they are actually the central regulators. They are also the most abundant leukocyte subset in the atherosclerotic lesions. In healthy arteries, the macrophages actually reside in the adventitia where they contribute to steady state functions, such as regulating the blood vessel diameter by interacting with the smooth muscle cells. And in certain areas of the aortic tree, such as the lesser curvature of the aortic arc, and also the branch points of large arteries, where macrophages they localize to the underneath of the endothelium, where they contribute to lipid retention. So this is a diagram of how foam cell formation occurs between the uptake and the efflux. So this diagram actually shows the uptake of oxidized LDL through the SRA and CD36 receptors. And from here, they are being processed through different types of enzymes and being effluxed out from the cells. So the deregulation in the homeostasis of the lipids accumulation within the cells will result in the formation of foam cells. What are the therapeutic strategies that are targeting atherosclerosis? So the first line of choice for lowering total and LDL cholesterol levels would be statins, and they have proven to reduce risk of coronary heart disease. It can also reduce the production of reactive oxygen species and increase the resistance of LDL to oxidation. Hence, they have shown that it's able to limit the oxidation of LDL, which contributes to their effectiveness at preventing atherosclerotic diseases. So the second option here would be anti-inflammatory therapies. In fact, this is a very promising and progressing field of studies where they are looking into pathways for current and future anti-inflammatory therapies. So I will bring you through the diagram here where there are several colored boxes. So the central red box here, which is defined by canakinumab. So this is actually a drug targeting at IL-1 beta, and they have already shown promising results in phase 3 clinical trial. And the ones that are in pink boxes, they are the ones which are currently in the clinical trials, and the ones in the blue boxes are actually the ones under preclinical development. So you can see from here that all these therapies are targeting into the immune inflammatory processes, specifically looking into the atherosclerosis in terms of modulating cells that are associated with the accumulation of lipids and also the inflammatory responses. Coming to that, there are also a very exciting area of research currently, which is the senescent-based therapeutics. And they are showing that age arteries, they are associated with different types of senescent cells. So we have seen endothelial cell senescence, vascular smooth muscle cell senescence, as well as foam cell senescence in the age arteries, where they are accompanied with the increased reactive oxygen species and increased markers in P16, P21, as well as the inflammatory responses. In addition to that, they are associated with reduced nitric oxide production as well as telomere attrition. All these are actually going hand in hand with the atherosclerotic diseases and hypertension. So this is a table here showing us in terms of the types of senescence-based therapeutic approaches for atherosclerosis and cardiovascular disorders. So there are various types of drugs, including senolytics, senostatics, and those are cellular senescence suppressors, which are used to inhibit cellular senescence, as well as some cell-based therapies which are used. So my current research on macrophage foam cells formation includes the identification of the roles of secreted phospholipase A2 enzymes on cellular proliferation and lipids accumulation. And I'm also very interested to look into the molecular pharmacology of natural-based bioactive compounds on macrophage foam cells formation. And it is also my area of interest to look into the role of NRF2 pathway on the foam cells accumulation. And lastly, I'm also currently looking into the role of senescent markers in macrophage foam cells formation. So in my study, I have shown the differential effects between two different types of secreted phospholipase A2 enzymes, which is the group 5 and group 10 enzymes on cellular proliferation and lipids accumulation in HT29 colon cancer cells. So it is well known that these group of enzymes are very much associated with cancer development due to their ability to produce the lipid inflammatory mediators, eicosanoids. And based on our results, we have shown that these two enzymes actually do not have much effect on cell proliferation, but they have differential effects at inducing lipids accumulation in these cells. So in comparison, group 5 has a lower ability and group 10 enzyme that have a higher ability at inducing lipids accumulation. And we also looked into the interaction between these enzymes and the various inhibitors, including one of the natural agents, muscarinic acid. And we have shown that they actually interact very differentially between the group 5 and group 10, and there are potential possibilities to use natural agents, including muscarinic acid, at targeting these two enzymes. So it is also my long interest to look into the pharmacological characterization of muscarinic acid, because I have been working on muscarinic acid for the past 10 years. And muscarinic acid is actually a very promising anti-inflammatory molecule. It is a pentacyclic triterpene, which has the structure as shown here. So meanwhile, so far, we have shown that they are able to inhibit protein kinase C isoforms. They're able to regulate NF-kappa B pathway, as well as the associated downstream signaling pathways. So what I have involved myself in my research team in the study of muscarinic acid and foam cell formations is that we looked into monocyte recruitment. So we have shown that muscarinic acid will be able to reduce TNF-alpha-induced monocyte adhesion to endothelial cells, and it is accompanied with the reduction of VCAM1 and MCP1 adhesion factors. However, our results didn't show a positive results on the transmigration. So we have also looked into the possibility of muscarinic acid at suppressing oxidized LDL-induced macrophage lipids accumulation, and we have shown that they are able to inhibit lipids formation or foam cells formation. So in addition to that, we want to look into the mechanism, how this occurs, and it was shown that muscarinic acid is able to inhibit the scavenger receptors CD36 and SRA expression, and it promotes moderate levels of cholesterol efflux. However, we do not show that they have any significant effects in terms of the ABC transporter protein expression. So all in all, based on our studies, we have shown that muscarinic acid is capable of inhibiting lipoprotein modification. They have antioxidant capacity. It is able to suppress lipids uptake, and they are able to suppress foam cell formation through the inhibition of monocyte recruitment. And we have also shown that they have promote moderate levels of cholesterol efflux. Moving on from there, we are also very much interested to study what are the roles of NRF2 in the macrophage foam cells formation. So we have shown very interesting results in terms of the opposing effects of muscarinic acid in terms of inducing NRF2 expression in HUVEC, inducing NRF2 expression in THP1 macrophage, but it inhibits NRF2 expression in the HUVEC itself. So in other words, muscarinic acid have very different effects in different cell types within the atherosclerotic region. So we can see that they can inhibit NRF2 in HUVEC, but it promotes NRF2 in THP1 macrophages. And we are also looking into the interaction between muscarinic acid and NRF2, where we have utilized the NRF2 inhibitor ML385. So we have shown that ML385 itself actually inhibits monocyte recruitment. So in other words, NRF2 itself, it activates TNF-alpha induced monocyte recruitment. So based on our results, we want to show whether or not there are any additive effects between MA, muscarinic acid, and the NRF2 inhibitor ML385. So we have shown that muscarinic acid, it enhances the inhibitory effect of ML385 in TNF-alpha induced monocyte adhesion factors expression. And we have also shown that they have similar inhibitory effects on the ML385 on oxidized LDL induced expression. Here we have also looked into the interconnection between NRF2 and NF-kappa B in THP1 macrophage and HUVEC itself. So we have shown that muscarinic acid by itself, it is capable of inhibiting NF-kappa B in both of the cell lines, both HUVEC as well as THP1 macrophage. When ML385 was introduced, we have shown that muscarinic acid have some additive effects in combination with ML385 in the HUVEC itself, but it has no effect on the THP1 macrophage. So what we have concluded from here was that using ML385 as the NRF2 inhibitor, we have shown that muscarinic acid and the NRF2 inhibitor is capable of reducing TNF-alpha induced adhesion factors expression, which contributes to their inhibition of monocyte recruitment. And together with muscarinic acid, it was also shown to have some additive effects on NF-kappa B. On the other hand, we have also investigated the effect of muscarinic acid together with ML385, the NRF2 inhibitor, in oxidized LDL-induced THP1 macrophage. So we have shown that together, they are able to bring down SRA expression, which is the scavenger receptors associated with lipids uptake, but the effects of CD36 is unknown. And they do not associate with any inhibitory or additive effects on NF-kappa B. So this is our outlook in terms of investigating the roles of NRF2 in muscarinic acid mediated suppression of the foam cells formation. And these are my references. Thank you so much for listening to me. And here I would also like to acknowledge the organizing committee for inviting me for the presentation today, as well as the funding body, including FRGS from MOHI, Taylor's Emerging Grant Scheme, as well as my collaborators, Prof. Lim Yang Moy from UTAR, Monash University, Dr. Goh, and my other colleagues in Taylor's University, as well as lastly, my postgraduate students, Ms. Pang Suwan, as well as also Ms. Ui Bi Ki. So currently our project is focusing very much on senescence-based factors in the macrophage foam cell formation, and I look forward to your questions. Thank you so much.